The scenario I choose to give my rationale is about a 45 years old African American female who has the complaints of fatigue for most of the time of the day for about last 3 months, which is also associated with shorter breath and some brittle nails. The fatigue doesn't go away with proper rest, even. She eats properly and does not have any other signs or symptoms related to this fatigue. She reported of taking of NSAIDs on regular basis for her long work shifts or dysmenorrhea. Patient herself is the only person in her family as strict vegetarian and um, also has history of GERD. But she does not take any medicine right now for her GERD. I would have to say that some more information, especially about some lab values, might be needed for the closest actual diagnosis. I would inquire more about which pain medicine she is taking as NSAIDs like aspirin or Tylenol. Uh, Sorry, not Tylenol, aspirin or ibuprofen. And also, I would inquire more about her stool, where the stool is black, tarry, any diarrhea, maroon in color, or any frank red blood passage or not. Provided that she responds with support of having some GI bleeding, might be related to gastric ulcer. I would go from there towards the actual diagnosis. Along with history of NSAIDs intake, I would let her know that NSAIDs need to be stopped. We could do Tylenol for her pain symptom. I would also introduce her other modalities of pain control like massage, heat or cold application, yoga, physical therapy if needed. And again, Tylenol for those breakthrough pain control. Additionally, we would talk about her diet pattern for nutrition, especially when it comes to have anemia related to nutrient insufficiency. With her strict vegetarian diet nature, she might have iron deficiency anemia. We have to increase her iron intake as supplementation or increasing dietary intake. Dietary intake of iron could be through beans, raisins, leafy greens, iron fortified cereals, nuts, especially cashews, dried fruits such as apricots, tofu, or eggs. We also could mention that red meat, liver, or fish are also very rich sources of iron, but if she wants to be continue to be strict vegetarian, she must pay attention to the mentioned vegetarian iron rich foods intake. Additionally, I would mention that vitamin C will increase the uptake of iron in the body, so she should increase vitamin C um, intake as well through supplementation or citrus fruits. Gastric ulcer prevention is the key because if you prevent ulcer, you prevent the bleeding, eventually you will prevent the anemia. So, regular and healthy food intake, decreased stress, adequate water intake, and proper rest or sleep would be advised on gastric ulcer prevention techniques. I would also prescribe some additional medications such as PPI or H2 blocker, which will prevent and help in healing of gastric ulcer by reducing gastric acid secretion. Moreover, I would refer her for GI visit to have additional testings or examinations to be done to confirm our suspicion of GI or gastric ulcer. So we could go from there after the confirmatory diagnosis and would prescribe medications as needed and follow up on hemoglobin and hematocrit labs to make sure that anemia is not getting worse. Thank you.